Spina bifida is the most common birth defect in the United States that is capable of permanently disabling someone. Spina bifida is Latin for split spine, and that's basically what it is. It happens when a baby is in its mother's womb and the spine doesn't form quite right. The spinal column, aka the vertebrae, doesn't close all the way. This leaves the spinal cord and the nerves exposed. These can both be very easily damaged, and the parts of the body that are below the affected area might not work very well or at all. In the United States alone, every day 8 babies are born with spina bifida. Spina bifida is this big overarching umbrella kind of a term for these 4 different versions of this split spine defect. Occult spinal dysrhythm is one form of spina bifida. Babies are born with a dimple in their back, and then the doctors check to see if they have OSD, and if they do, it's recommended that they go see a surgeon, because if they don't, as they grow, their spinal cord might not grow into the correct place, and it'll cause some serious problems as they're growing up. Not every baby born with a dimple on its back has spina bifida, but the doctors do check just in case. Spina bifida occulta is another form. This one is also known as hidden spina bifida because 15% of healthy people have it, but they don't realize that they have it. It usually causes no harm, and there's often not really any visible signs that a person even has it. Most people who have it find out they have it by going and getting a back x-ray for something else entirely. But a very small group of people who do have SBO do feel pain and have neurological symptoms that go along with it. But the majority of people who have it do not need any treatment for it. Meningocele is yet another version of spina bifida. In this version, the spinal cord pokes through the spine and makes a little sac of nerve fluid. The nerves are not normally damaged by this. Children who have it are given surgery, and more often than not, they are not paralyzed, but they will probably have minor disabilities. The last and most severe form of spina bifida is myelomeningocele, also known as spina bifida cystica. In this form, parts of the spinal cord and nerves push through the spine. It causes nerve damage and disability. 70 to 90% of children who have this version of spina bifida have too much fluid in their heads, and if it doesn't get treated, then their heads will expand and it'll cause brain damage. Children who have this version are operated on within 3 days of being born. Surgery can keep it from becoming fatal. The scientists are not 100% sure what causes it. Cases of spina bifida have accurately been reported back to the 17th century, and there have been cases that are similar to it from even centuries before that, so it's been around for a while, and there's no cure as of right now. But scientists do think that if women who are planning on having a baby take folic acid 3 months before they get pregnant and 3 months after they get pregnant, it can lower the chances of their child having spina bifida. People with spina bifida can have mental and social problems, bathroom problems, latex allergies, obesity problems, skin breakdown and gastrointestinal disorders, learning disabilities, depression, tendinitis, and/or sexual issues. But there are treatments. I've already talked about surgery, but there are also diets and mobility aids like braces and crutches and wheelchairs. It's important for kids and just people with spina bifida to learn how to be independent. For example, if you see someone in a wheelchair and they ask you for help, then you can help them. But if they don't ask you for help, then it means they've probably already figured out how to be independent on their own, and they truly do not need your help in that moment. It's also important for kids to be able to hang out with other kids and to play and just be a normal kid, even though they might be in a wheelchair or on crutches. In the description below, I've put some links if you want to learn some more about spina bifida on your own, because obviously I couldn't cover everything in one video. And there's also a link if you want to help donate to research. I will see you guys next week in my next 2 videos for the October Awareness Project. Goodbye, guys.